Professional English in Use. Chapter 10. Primary Care. Primary Care. The National Health Service. The National Health Service, NHS, is responsible for health care for everyone in the UK. Although a small number choose to pay for private care, treatment is free, but there is a prescription charge for drugs and appliances, such as cervical color, with exceptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20 practices are based in a surgery and look after the health of from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet. From clinics give vaccinations, for example, for influenza, and may perform minor surgery such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes chief of GPs and local GPs to cover if someone is absent. No, the non-surgery has 3 minutes. The building where GPs work, the practice have moved to a new surgery on the high street. A time when GPs see patients, morning surgery is from 8:30 to 12:30. The work of surgeons. The patient needs urgent surgery on a burst appendix. The practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, taking messages from patients and other health care providers, and for filling and scanning documents into patient records. The practice manager has responsibility for finance and sometimes for it supervises reception staff. Hires locums and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to change dressing, such as ulcer dressings. Health visitors visit families to carry out checkups on young children, particularly under 5, to make sure they're healthy. Special attention is paid of families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists hands-on treatment, but also teach patients exercises they can do to improve their condition after an accident or operation. A GP's day. Dr. Stewart works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she's not the duty doctor responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery. Check the OOH email printout. Check for urgent and not urgent messages. 8:30 a.m. Check emails from the health board and patients prepare for surgery. 8:30 to 10:50 a.m. Morning surgery. 10-minute appointments. Seats pre-book last week to book 48 hours ahead for bookable on the day. 10:50 to 10:55 a.m. Chat with reception for messages. Sign prescriptions and deal with repeat prescription. 11 to 11:20 a.m. Coffee break in the conference room with colleagues. 11:20 to 11:30 a.m. Check home visit requests and divide up visits with 11:30 a.m. to 1 p.m. home visits. Exercises. Exercise 10.1. Complete the sentences. Look at A opposite to help you. Children over 60 and people with some chronic diseases do not have to pay prescription charge in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment in 10 minutes long. A locum GP is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out of hours treatment. 10.2. Make word combinations using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. Change dressings. Make appointments. Perform minor surgery. Refer a patient. Run a clinic. Supervise messages. Take staff. 10.3. Which member on a practice team would be responsible for each of the following? Look at B opposite to help you. Running a clinic for pregnant women. Midwife. Teaching a patient how to strengthen his broken leg. Physiotherapist. Letting the GP know that the patient can't come to her appointment. Receptionist. Running a clinic for people who want to lose weight. Practice nurses. Visiting a patient who has returned home after a hernia operation. District nurse. Carrying out checkups on children in a poor neighborhood. Health visitors. Organizing cover for an absent doctor. Practice manager. 10.4. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. 1 to 2 p.m. practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon surgery, 12 10-minute appointments. 4 to 4:20 coffee break. 4:20 to 5 p.m. check with reception for messages, deal with home visits, and repeat prescription requests. 5 to 6 p.m. paperwork, e.g. referrals to secondary care, admin task, telephone calls to patients, private medical examinations. 6 p.m. phones switched to OOH service.